All right, so we discussed over-the-counter medications. So over-the-counter medications are approved by the Food and Drug Administration. These are regulated, they're tested. You can't just say, hey, I made acetaminophen. It has to actually be acetaminophen. It has to be that chemical structure of it. So different people can create it, right? The Tylenol manufacturers, Kroger can create it, CVS can create it, Costco can create it. It's all the same. And so those have to be proven that it's the same medication. So herbal and dietary supplements are different. We'll talk about the Dietary Supplement Health and Education Act of 1994. So this act said that herbal products are considered dietary supplements. So there's no proof of efficacy or safety required. So we don't have to prove that it works or prove that it's safe, which is kind of scary. There's no standard for quality control. Not saying if you have 8 manufacturers of ginkgo biloba, they don't all have to be the same. And then these people can claim an effect, but it doesn't, but don't have to promise a specific cure. All right, so here's an example label. This is for omega-3, which is fish oil. There are some claims that it can have heart and brain health. So here they just have that generic statement that it supports heart, brain, joint, and skin health. Let's see. Spotlight here. So here we see the ingredients. Oh, goodness. Sorry about that. All right, so we see the ingredients here. We have suggested use, 2 capsules or prescribed. So it doesn't even tell you what to take. It's just suggested use. And then warning here, talk to your doctor, talk to your healthcare advisor, which is kind of a weird statement, if you're pregnant, nursing, taking blood thinners, or diabetic. So we take blood thinners to prevent clotting. That's the whole purpose of having this medication. So if we are taking a blood thinner and this medication interacts with it, we could either start to bleed, that's very dangerous, or develop clots in the area we're trying to treat. So that could be like a stroke, super dangerous. And then a diabetic patient could either have a really high blood sugar or really low blood sugar. So this medication has this tiny little statement that says to avoid that. And again, I just really don't think patients are going to read that. So let's see, we've got some information here. And then over to our left, it just has a bunch of information about the food supplement. So, all right. So, I say, I'm talking about kind of the negatives of herbal supplements. Really, it's just that a lot of different people or a lot of different manufacturers can produce these. There's not a lot of consistency between them, and it's not super well regulated. So it just has some potential for danger. Now, there are benefits to using herbs. So this is more of an Eastern medication or Eastern medicine tradition. These herbs can treat and cure diseases. They have been proven to do that, prevent diseases, and then overall boost the immune system. Here are some commonly used herbal products. There's a list of these. So aloe helps with burns. It's an antioxidant. There's, you go to the drugstore, there's a huge container of aloe juice. I've never had that. It can decrease inflammation as well. Feverfew is the next one. It's good for fevers, migraines, rheumatoid arthritis. Ginkgo has claims to improve memory, but there's been no quality research done on that. And then St. John's wort is for depression. I'm sure it works, but it has so many interactions. It can reduce plasma concentrations of oral contraceptives, which are birth control pills. So what happens if we decrease the plasma concentration of birth control pills? You could get pregnant. Reduce concentration of statins, which are a high cholesterol drug, and then warfarin is a blood thinner. So again, we have that risk for potentially developing a stroke. All right, you may see this abbreviated as CAM, so Complementary Alternative Medicines. These are often 2 terms seen together, but they are different. Alternative medicine is the use of herbal products and other non-traditional remedies. Complementary medicine is the simultaneous use of both traditional, which is like Western medicine, prescribed drugs, and alternative medicines. All right, so I'll have you pause the video here and answer the following 4 questions. All right, welcome back. So for the first one, we have which supplements interact with anticoagulants? So these are blood thinners, quote unquote. So these are, from what I found, chamomile, garlic, ginkgo biloba, ginger root, and St. John's wort. The next question is, which supplement can induce serotonin syndrome? So serotonin syndrome is a condition where you have too much serotonin in your body. It results in this like increased muscular tone and reflexes, high heart rate. It can be very, very dangerous. So these are 5-HT, which is like the part that makes serotonin, and then St. John's wort. The next, which supplements can interact with cardiac medications? Ginger root, hawthorn, and St. John's wort, again, because it interacts with a lot of things. And then the last one, which things can cause sedation, are kava and valerian. So these are 2 herbal substances that are used to increase sleep. They're used with anxiety to decrease that. So, you know, they can cause sedation, which can be concerning if somebody is drinking alcohol or using potent anti-anxiety medications like benzodiazepines. This additive, sedative effect can be dangerous. All right, now how are we going to keep our patients safe? Knowledge is power, so we just learned all of that information. So what are we going to do to keep our patients safe in terms of the use of oral or over-the-counter and herbal supplements? So we're going to take a full drug history. I think it's just not really common practice to get information about over-the-counter medications and herbal supplements. In the ER, typically the medication list consists of prescribed medications. So we need to be asking about over-the-counter medications and herbal supplements. We need to ask about drug allergies. It's never wrong to ask about drug allergies. The patient may have a drug allergy that's interacting or basically having an effect from the medications that they're taking. We want to ask about alcohol, tobacco, and street drugs. And then we want to do a knowledge check and provide patient education. So with our knowledge check, we want to see, hey, do you know what this drug is for? Why are you taking it? How often are you supposed to take it? Do you know if it has any interactions? And then it's our job to educate the patient, and teach back is always the best. So say, hey, you're taking your ginkgo biloba for memory, but it could have these interactions. How do you feel about that? What are you planning to do? What kind of interactions does it have? And just kind of verify that they understood what you were talking about.